All right, we're on. So I have a practical tomorrow on administering intramuscular and subcutaneous injections. So I'm just gonna run through my practical as if I was being tested. I'll try and post a picture of the rubric that I'm gonna be graded off of. It looks like this. I'll see if I can get a picture of it on the video. So I'm actually going to start, and then I'd also be given a MAR. So during my practical, I'd be given a MAR like this, blank. It's going to have patient's information, the medication they need, times, stuff like that. So I'll give you a little context. This MAR says that I have a patient, he has type 1 diabetes, and one of the prompts says that during the assessment, the client had labored breathing and crackling was heard during auscultation. And then it also says that we have a medication, a stat medication, so like a high priority medication. So it would look like this. It'd be blank, empty. And I'm gonna start from entering the patient's room. So that means I've already looked at labs, I've already calculated dosages, done a lot of my med math, gathered supplies, and I'm to the point now where I'm heading into the patient's room. So I'll start from here. So I'm gonna knock, set my stuff down, introduce myself. Hi, my name's Jesse. I'm gonna be your nurse today, and it looks like I'm gonna be administering your 7:30 a.m. medications. Before we begin, can you do me a favor and verify your name and date of birth for me? And as our patient verbalizes their name and date of birth, I'm just going to compare it to the MAR. So they verbalized that. I've checked it with my MAR, and then I'm also going to check their wristband, and then I'll look at the MAR, their wristband, just make sure that also checks out as well. And then as I'm looking at my MAR, I'm just going to let the MAR kind of guide me through everything I need to go to. So I've already done the name, date of birth, verified that. And then we also have an allergy here. It says aspirin. So I'm going to ask about the allergy. I'm going to ask, I see you have aspirin as an allergy here. Are there any other allergies that you're aware of? And they're probably going to say no. So obviously if they said something, I would notate it, but our patient says no. So next, again, I'm just going to let my MAR guide me. I'm just going to run through the medications that I'm going to be administering, explain a little bit about them, and possible side effects. So it looks like we're going to be administering diabetes, and that's going to be we're going to be administering diabetes. We're going to be administering insulin, and that's to help with your diabetes. We're going to be administering furosemide, and that's going to be for the labored breathing and the fluid in the lungs. And lastly is the acetaminophen, and that's going to be for pain. So with lots of these types of medications, you may experience nausea, fatigue. If you feel anything out of the normal, please let me know. That's what I would say. And I just use nausea and fatigue because that works for almost anything. So I'm going to start with furosemide because that's a stat medication. When I look at my MAR, it actually says furosemide 40 milligram stat. So I got to do that first. That's a priority medication. So with furosemide, that's a diuretic, and that's what's going to help draw the fluid out of the lungs. But it's also reduces blood pressure. So by again, you're urinating out, you're peeing out the fluid inside your body, and that's gonna affect blood pressure by drawing the water out. So with furosemide, we need to get a blood pressure reading. So before I can administer that, I gotta check blood pressure. So I'd wash my hands, pretend you didn't see this, and then I'd don gloves. I know that's a weird word. I hate saying it. Don. But I'm going to apply, put gloves on, don, whatever. So my gloves are on. I'm going to get a blood pressure reading from my patient. If blood pressure is too low, I'm going to hold the drug and I'm not going to administer. Our patient's within range. He's cool, so we're going to proceed. So again, I'm going to go back to my MAR. Furosemide says it's intramuscular. So I'm going to look at my MAR, and it says furosemide 40 milligrams. And I'm going to look at the medication that I prepared. And I wrote on there, I labeled it already. It says 40 milligrams furosemide. So I've double checked. This is furosemide. I have 40 milligrams, and then my MAR says I need 40 milligrams furosemide. So I've double checked, verified that's correct. And I also have about a 1 milliliters worth of volume inside my syringe. So 1 milliliters worth of volume, intramuscular injection. I'm gonna pick the deltoid. We could do the vastus lateralis. We could also do the ventral gluteal, but the deltoid's pretty easy, so that's where I'm gonna go. So to find my injection site, let's see if I can move this over here. To find my injection site for the deltoid, I'm going to be looking for this. It's like a bony prominence on the very top of the shoulder, and once I find this landmark, I'm gonna get 2 fingers and go 2 fingers just underneath that landmark. And once I have those 2 fingers there, I'm going to be injecting. My injection is going to be right underneath those 2 fingers. So after I've identified my injection spot, I'm going to get a alcohol swab. Actually, before I get the alcohol swab, I'm going to palpate the deltoid area, and I'm going to assess for any tenderness. I'm going to ask if there's any pain or discomfort. Obviously, if there's pain or discomfort, I'm not going to inject there. I'm going to try to find another site, maybe the other deltoid or maybe the ventral gluteal. But again, our patient's cool, so we're going to proceed into the deltoid. So this is where I would get my alcohol swab pad, and I'm essentially just going to clean the area that I'm going to be injecting into. And I have my medication, my syringe, and I'm going to use one hand to basically push one hand into the skin, and all this hand is going to do is pull the skin tight, and with my other hand I'm going to try to get a good angle. I'm going to go straight into my injection site, and then with my hand that's free, I'm gonna grab the syringe, I'm gonna anchor it, and then I'm gonna aspirate 0.5 milliliter, inject my medication, and then all at once I'm gonna let go and pull out, and then I'm gonna toss this straight into the sharps container. So after I do that, I'm gonna ask my patient to hold a little piece of gauze over the injection site, and then I'd move on to insulin. So again, I'm just going to refer back to the MAR, and it looks like our MAR says that we're going to be administering 8 units of NPH and 6 units of R. So I'm just going to verify with the medication that I prepared to my MAR. Everything matches up. I have the correct medication. And our insulin is a subcutaneous injection. So we're going to do the abdomen. So it's essentially 2 inches outside of the umbilicus belly button area. And once I find the site that I want, I'm going to palpate that area, ask if there's any pain or discomfort, any tenderness there. Obviously, if there's pain there, I'm not going to inject there. I'll find another, maybe on the other side of the belly button, or usually on the back of the arm. There's a good spot. There's usually a lot of fat back here, or like the side of the thigh. That's another option. But again, our patient's cool, and we're going to go straight into the abdomen. So I'm going to get my alcohol swab, and I'm going to clean my injection site. And the insulin is actually a little bit easier because once we've cleaned our spot, we're just going to pinch the skin a little bit, like a little piece of fat, and we're going to inject, or we're going to insert our needle, inject our medication, then let go, pull out all at once, and toss our syringe into the sharps container. Lastly, we're going to do the acetaminophen, and with that one, I think I might just get a pain scale from them. So I'd ask them, you know, on a scale of 1 to 10, what do you rate your pain? And then I would notate whatever they told me. So if they said 3, I'm going to put 3 next to the acetaminophen on the MAR. And then while I have the MAR, I'm also going to double check my medication. So it says I need acetaminophen, 650 milligrams. I would check the medication that I prepared. I have 2 325 milligram tablets, so my math checks out. I verified everything. And the only other thing I would offer is I'd get the patient water. That way he could drink it with the tablets. And then before I left, I would just ask the patient if they had any questions about the medications, any concerns, and then I would move on to the documentation of the MAR. So I would cross out the time that I administered the insulin. So 7:30 a.m. I'd put a cross through that. I would initial that, and then I probably would also notate the glucose reading that I got from the AccuCheck. So I'd put that in there too. The furosemide, same thing. I would cross out the time, 7:30 a.m. And then I'd initial that, and then I'd also put the blood pressure reading, so 120/80. And then the pain, the acetaminophen, I'd also cross out the time, initial, put the pain scale there. And then I'd also print my name, signature, student nurse, CGCC, and then initials, and that should be it. And that only took 12 minutes.